sleeping during pregnancy. How much does it require? Am I sleeping excess? So she is gonna address all these doubts today. Welcome, Dr. Padma.
Thank you, Sima. Hi, everybody. I'm Dr. Padma Srivastava. I'm a senior gynecologist at Motherhood Hospital of Lulanagar, Pune. Uh, Today, I chose this topic, which is slightly different. Is sleeping too much in pregnancy normal? I mean, this is a topic which not really addressed by most of the gynecologists, but on the patient's mind, this is a very important topic. There are a lot of myths, lot of wrong information in patient's mind regarding this thing. Now, in brief, I'll just talk about this, and if any patients have any doubt, they are free to ask. Now, first is sleeping in pregnancy. Why is there an association? So first thing is, in pregnancy, women do feel very, lethargic and feel more sleepy than usual. Why so? See, in early pregnancy, there are a lot of hormonal changes which happen very quickly. A lady becomes pregnant, the hormone progesterone becomes very high. This causes a lot of letharginess in the lady, and she feels a bit low in energy. So the will to get up and do some work becomes less. Secondly, what happens is the digestion also becomes slower. So a lady has a meal, she takes longer time. That in the medical term we call it as gastric emptying time. The food that she takes in the morning, say by 8 o'clock, for it to get digested and give the lady energy takes about 2 to 3 hours. That is 2 to 3 times longer than the normal patient. So despite, and she has a food, she takes time to digest, and after digestion majority of that energy is transferred to the baby. So these are certain factors which leads to the lady being low in energy, lethargic, thereby she feels very dull and dopey and sleepy all the time. Now, what should she do? Should she sleep the whole day? Is that recommended? Or despite feeling sleepy, she should get up and do work? What is recommended? So, what we advise is we talk to the patient and we explain to her that yes, being lethargic, dull, sleepy is normal in pregnancy. Don't worry. At times, you will feel a bit feverish. It's normal. So, what should you do? One, try to stick to your normal routine. Get up in the morning, have your breakfast, do your morning chores. If you're a working lady, go back to work. It will help you feel energetic and active, and give yourself more time to sleep and rest. Even in your workplace, take some time off, 15 minutes, go and lie down. After lunch, sleep for well, an hour or so. At night, don't have late nights, have an early dinner, try and get to bed by 10, sleep for 6 to 8 hours. That time, resting time is required. Your body will respond better. So don't fight sleep on one hand, and on other hand, don't sleep the whole day. I mean, if your doctor tells you that yes, feeling sleepy is normal, that doesn't mean she should get up at 12 in the morning.
Right.
So she has to balance it out. But if a lady, even at workplace or even at home, says that I'm feeling sleepy, I need to go and sleep, don't feel guilty about it. Lie down, rest, sleep. It's never harmful, never ever harmful.
So what is the ideal time that should sleep? कितने घंटे सोना is ideal according to the doctors?
Ideal. If she can do it, about 2 hours in the afternoon and about 6 to 8 hours in the night. This is recommended. She can take a little bit of naps in between also, if time allows and if her work schedule allows. That's okay. So after breakfast, she finishes her work at home. It's around 15-20 minutes. She lies down. Fine. But recommended, I would say 2 hours afternoon and 6 to 8 hours in the night.
So जो प्रेग्नेंट लेडीज रात को सो नहीं पाती है बिकॉज फ्रीक्वेंट यूरिनेशन होता है, एंजाइटी
Yes.
होती है, स्ट्रेस होती है, व्हाट कैन दे डू टू जस्ट इम्प्रूव देयर स्लीप सो दे डोंट स्लीप एक्सेस इन द डे एंड दे हैव इनफ स्लीप एट नाइट?
Yes. So there are few things that we recommend so that the patient sleeps well in the night. One is that the afternoon sleep should finish by 4. She should not sleep till 6 in the evening. So she has her lunch by 1:32, sleeps for some time, and by 4 she should get up and start her evening work. Night dinner, she should have bit early. By 8 o'clock, she should finish her dinner. After dinner, she should have a stroll, walk around a bit so that she digests her food. Post dinner, say when she goes to bed by 10:30, she can have a cup of warm milk, a little bit of dry fruits, and at that time we ask the patient not to do anything active, like no phone calls from parents and friends, no bright screens in front of the eyes, means no WhatsApp, no laptops, no TV. She should dim the lights, have a bed lamp, read a book. If she's not feeling sleepy, she should not try and force sleep. Read a book and she'll feel sleepy and go off to sleep. So, a heavy dinner, a late dinner, and activating your brain at late in the night. Suppose you have a very energetic conversation with your relatives, or you're, watching a very a thriller movie in the night, you won't feel sleepy. So after 8, you should have a very sedated time. Read a book. You should have finished your dinner at least 2 hours prior to going to bed, and a warm cup of milk and a warm bed helps to sleep.
ओके. सो आफ्टरनून में एक्सरसाइज करने के बाद काफी प्रेग्नेंट लेडीज को नींद आती है. शुड दे स्लीप इमिजिएटली और दे शुड हैव अ गैप बिटवीन देयर एक्सरसाइज रूटीन एंड स्लीपिंग?
See, after exercise, sleep I don't think would be is what the patient feels. She may be feeling a bit dull and lethargic. Rest is okay, but
Okay,
sleep, no, not after
not
exercise.
recommended.
No, no, no.
So what are the benefits of having an ideal sleep, and what are the drawbacks? कैसे sleep अगर sufficient नहीं होती है pregnancy में, how does it affect the fetus?
Okay. So adequate sleep is good. It rests the patient. It helps in digestion, and moreover, what happens is when the lady is resting, the blood supply towards the baby increases. See,
Okay.
each time the heart beats, there is some amount of blood that is, pushed into the circulation. Each time the heart beats, 60 ml blood is circulated in the body. So when a patient is resting, then the blood supply to her hands and legs is less, and blood supply towards the baby is more. So, after she has her meal and when the lady is sleeping, the blood supply to the baby improves. So, baby gets good nutrition, oxygen supply. Secondly, once a lady is resting, she digests her food, and it helps in, overall rest and recovery for the patient.
Okay.
Now, if she doesn't get adequate sleep, what are the drawbacks? She will end up with acidity, end up with gases, overall muscle pain, headaches, and indirectly the stress levels increase. And women who tend to sleep poorly during pregnancy also tend to have higher BPs later in pregnancy. They also have acidity. They also end up having constipation, and therefore all the time they're coming to doctors saying stomach pain and headache and back pain because they are not rested adequately. And another thing is, see, natural ways of trying to sleep is always important in pregnancy because we cannot give a pregnant lady sleep medicines.
Right.
Uh,
So जो प्रेगनेंसी में सप्लीमेंट्स मेडिकेशंस जो पेन रिलीफ मेडिकेशंस या फोलिक एसिड सप्लीमेंट्स देते हैं उससे स्लीप इंड्यूस होती है. डज पीपल द प्रेग्नेंट लेडी फील स्लीपी बिकॉज ऑफ दैट? इज दैट ऑल्सो वन ऑफ द रीजन?
Never, never, never. See, the only medicines that are recommended, the only medicines that we give in pregnancy is vitamins, iron, calcium, vitamin D, and protein supplements. This will never cause sedation. Like I said, it has the hormonal changes and the differential blood supply, means blood supply going more towards the baby, less to the mother. These are the things that induce sleep, but never the medication. And painkillers are never recommended in pregnancy. The only painkiller that we give in pregnancy is a slightly higher dose of paracetamol. And in very rare conditions, when the patient has really a bad leg cramps or backache, we give tramadol. There's one tablet called tramadol. That's the only recommend. We never give any painkillers. No diclofenac, no Volini, nothing. Never recommended.
Okay. So I'm sure काफी informative session था. We came to know a lot about sleeping. So Dr. Padma is on a baby chakra consultation. You can click on the link given below in the feed post and consult her for any doubts related to gynec, your sleep, your pregnancy. She will always be available. So Dr. Padma, we have a couple of user questions coming up. Can we take that?
Yes, yes,
Okay. So there is this lady who's on IVF treatment and she
yes,
feels जो treatment पे वो है injections hormonal tablets
yes,
जो दे
yes,
रहे हैं उनको
yes.
उनकी वजह से वो बहुत fatigue sleepy महसूस करती है. What can she do to avoid excessive sleeping because of that?
Yeah. Now in IVF, they a lot of progesterones are given to the patient. Like initially, जो मैंने बोला था आपको कि the pregnancy hormone causes sedation and drowsiness.
Hmm.
And in IVF, over and above what the patient's body is producing, progesterone injections, progesterone capsule, progesterone gels are given to support the pregnancy. So these patients tend to feel even more drowsy. Not only drowsy, they feel giddy. So first and foremost, don't feel guilty. If you're feeling sleepy, up late जाइए, सो जाइए. But maintain your schedule. Eat on time. Walk for at least 15-20 minutes, even if it is inside the house. 15-20 minutes morning and evening up stroll kariye so that you at least digest your food. Lie down, sleep. Sleep will never harm the baby. Just remember, it will never ever harm the baby. It, how can it have adverse effect is patient बहुत ज़्यादा सोती है तो she will end up not digesting her food. She will end up missing her food times. जैसे सुबह 12 बजे उठ रही है तो she'll miss her breakfast. That way it can have effect, but sleeping excess is never going to harm the baby. Now, Mrs. Ayushi has asked that she's 8 weeks pregnant,
Yeah.
and she says she's not able to control her sleep. No need to control your sleep. If you're feeling very very sleepy, sleep. गेट अप ऑन टाइम, हैव योर मील, थोड़ा सा आप स्ट्रोल करो कि वो खाना डाइजेस्ट हो जाए, स्लीप अगेन. Sleep will never ever harm your baby. Now she's also asking, should I sleep on right side or left side? See, at 8 weeks it does not matter. Why do we say right side or left side? Is normally as the baby grows in the fifth or sixth month, the baby takes up a position. Baby is either on the left side of the mother or the right side of the mother. मतलब एक करवट पर जैसे सोते हैं ना हम वैसे. So if the baby is on the left side or the right side, so the mother has should not sleep on her back. She should sleep, you know, ideal position would be if she sleeps turned to the left, so that
Right.
the baby gets adequate blood supply. But at 8 weeks, it doesn't matter. Baby is so tiny, it just will not matter. She can sleep on either left or on right side, but try to avoid sleeping on the back so she can put a pillow beside her so that her hips are slightly tilted to one side. That's the only thing. But don't fight sleep, sleep it off, and don't feel guilty. Excess sleep will never ever harm the baby.
So doctor, what you mentioned about sleeping on the left side, जिसकी वजह से baby को blood supply होता है, that's a very commonly asked questions. Because me being a health and wellness author at Baby Chakra, we come across so many questions, and this is like few people feel it's a myth कि left side सोने की वजह से blood supply ज़्यादा जाता है. किसी किसी को ऐसे believe करने के लिए भी मतलब we keep on asking कि left side में सोना चाहिए right side. So it's okay to sleep in any position, right?
Any position, as long as she's directly not on her back, because what happens is the blood, the mother's spine, the blood from the heart, the blood vessels are lying on both sides of the spine. So at the sixth, seventh month, once the baby's weight is on a higher side, so baby becomes about 800 grams to 1 kg. If the mother is directly lying on her back, then the baby is lying on the mother's spine.
Right.
So the baby's with the baby's own weight, the blood supply becomes lesser. So
Mm.
she need not sleep on a side. She can just tilt to one side. That is enough.
Right.
So either left or right, just tilt away from the back so that the baby's weight does not fall on the blood vessels. That is the only thing. Others left or right, it doesn't matter.
We have another mother who is asking कि what should I avoid in dinner कि मेरी sleep disturb ना हो, because she is suffering from gas, constipation and a lot of
Yes,
problems. So what is
yes,
the solution to it?
yes. So first is have a early meal. Finish off your dinner by 8. And like we say, eat like have your breakfast like a king, have your lunch like a common man, and have your dinner like a poor man. So what you should have for dinner is something, what I suggest tell my patients, have something continental, like have a soup, Don't have anything that is spicy, anything that is too sour. मतलब ज़्यादा खट्टा और मिर्च डिनर में totally avoid करना है. So have a good bowl of clear soup, have a chapati, halka sabzi, and that's it.
Okay.
So nothing spicy, nothing oily, and not heavy.
Okay.
And for this, I'll also suggest avoid having tea in the evening. Many people have this habit कि 5-6 बजे चाय पीते हैं. So the patient lose their appetite with that. So avoid that evening tea. Have your dinner by 8. After that, finish off your dinner. At bedtime, if you feel hungry, have a cup of warm milk and have some dry fruits like kaju, badam, anjeer. This also helps in acidity. And sleep. Another one small point to note here is that dry fruits should be avoided in the morning. See, normally log utke they have badam in the morning, badam and akhrot and all at the breakfast time. That avoid. Now the reasoning behind this is see almonds, walnuts, pista, they're all oil nuts. They take a long time to digest. So if you have dry fruits in the morning, you won't feel hungry the whole day. So have an early light dinner. At bedtime at 10, 10:30, if you feel hungry, have some dry fruits. So these oil nuts will give you and the baby energy throughout the night because it takes a long time for these dry fruits to digest. So cup of warm milk, some dry fruits at bedtime and go off to sleep. That will never cause acidity.
Okay. So we have another user, Nikita, who's
Yes.
asking, ki, I am 5 months pregnant and my back keeps on aching when I sleep. What is the solution to it?
So one is that mild back exercises can be done. Now there are certain in yoga there are certain asanas. One is that setu asana where you lie down on your back and lift your hips.
Hmm.
There are some side stretches which very mildly it can be done to take off the spasm in the back muscles. And again, like I said, always sleep tilted to either side. Don't sleep on your back. If you can sleep entirely curved to the side, very good. If you don't want to sleep entirely on the side and your arm hurts, then just put a pillow on the back and tilt to one side. And mild yoga exercises for lower back pain will really help in the evening.
Okay. So my next
But no
question.
back, but no back massages and
Hmm.
no applications of any ointments on the back. Back massage should not be done in pregnancy.
Okay. So can they use hot water bag under their back to relieve it? Is it
Yes, yes.
okay?
Hot water bag can be used. Yes.
Okay. So the next question is, should I avoid drinking too much water before the bedtime because to avoid frequent urination? Should that be
Yes.
recommended?
Yes, see, at bedtime, drinking too much of water as it is not recommended. You drink water throughout the day. Night, you have your dinner, have your usual water that you want to have. And before going to bed, pass urine once or maybe twice and then go to bed. But if you're feeling thirsty, then don't avoid water.
Okay.
But don't take excess water. I mean, taking 4 glasses of water before going to bed again is definitely not a sensible thing to do. If a person is feeling thirsty, have water. Then before going to bed, pass urine once or maybe twice and then go to bed.
Okay. Another user, she is in her third trimester. उनको लगता है कि prefer to first and second trimester, third trimester में उनको ज़्यादा नींद आती है. Is it normal or it's
Yes.
not normal?
It is normal. It is normal. See, but what I feel that in the first trimester, the sleep is a lot. By third trimester, the patient starts feeling a bit energetic and good. But if you're feeling sleepy throughout the day, then there are certain things they should try and find out that is she getting adequate sleep in the night? Is she sleeping well throughout the night? If you get good, restful 6 to 8 hours of sleep in the night, then in the morning hours, she should not be feeling sleepy. So
Okay.
that is one thing she should see. Like some people have what is called as sleep apnea. They sleep in the night, but they don't get good, fitful sleep in the night.
Right.
So try and see what is bothering you in the night. Is your nose getting blocked? Are you having acid regurgitation? Like, are you not comfortable in the bed? So
Hmm.
you sleep, you feel you're sleeping for 8 hours, but you're not getting that restful sleep.
Right.
So one that point should be addressed. So maybe acidity is troubling you. So maybe an antacid or like what I told about the diet changes in the night. If she can
Hmm.
do that, and she can sleep in semi-reclining position so that her nose doesn't get blocked. Many
Okay.
women tend to snore and tend to have sleep apnea in the third trimester. So to prevent that, just saline nasal drops and sleeping in semi-reclining position, and like I told you, an early dinner. This may help in getting her good restful sleep, and an hour of sleep earlier in the afternoon by 2 to 3 or 2
Hmm.
to 4 o'clock in the afternoon, if she can have a sleep, then this should take care. But despite this, if she's feeling sleepy throughout the day, then she should try and find out why. Because I feel in third trimester, a lady should feel more energetic and less sleepy.
Okay. So my next question is, Nikita is asking that she's suffering from cold since the time she's conceived, and that is not allowing her to sleep. What is the solution to it?
So, two solutions: is it cold or is it a nasal congestion? If it is a cold and she keeps sneezing also in between, then she must meet her gynecologist. There is a nasal drop that we give, which decreases the congestion. It's called Dionase, but she should talk to her gynecologist. So we give, initially we may give her a mild anti-congestant, anti-allergy medicine in the night, and we give her these nasal drops which she should take throughout, so that it decreases the congestion, and what she feels is a cold, maybe just a local congestion of the nasal mucosa. If that decreases, then she'll be able to breathe freely from her nose and sleep well.
Okay. So coming to the last question, there is this user who is suffering from migraine. She is a known migraine patient, and she has been refrained from using medications during pregnancy. So उनको रात को बहुत ज़्यादा headache होता है and she is not able to sleep. Is there a particular position that she can try or some solution that you might give her?
Yes. Now, see, if she's had a migraine problem since a long time, she would understand that there are certain trigger factors for the migraine. What is it that is aggravating it? Is it acidity? Is it lack of sleep? Is it that she's eating or drinking something which is triggering the headache? So first, she can find out what is causing the headache and avoid that, like excess oily, spicy food, a late dinner, or lack of sleep, or maybe some loud noise, or some stressful environment.
Hmm.
So she can avoid all that. Secondly, there are certain medicines that we give in pregnancy, a simple tablet called Grenil.
Okay.
So she that is safe in pregnancy. It is a combination of two medicines, and one is paracetamol, so it doesn't have any side effects. She can again consult a gynecologist and take one tablet after dinner. So if she takes it continuously for 2 to 3 days, she can avoid this headache. In the meantime, she can see what are the trigger factors that is causing the headache. Secondly, in migraine, there is a time when slowly the headache builds and then it peaks. So if she takes this tablet when the headache is just building up, then she can avoid that peak headache,
Okay.
which causes that visual symptoms and
Hmm.
nausea. And so that's a simple tablet called Grenil she takes at the beginning of the headache.
Okay.
Ideal will be if she can avoid the headache altogether, find out what is it that is causing the headache. In every patient who has a history of migraine will know what triggers the headache. She should
Right.
avoid those trigger factors.
So, are there any natural remedies to control that headache once you know the cause of it? You
Yeah,
can
one
use
is to know the
natural
cause.
remedies
The
also.
natural ways to avoid the headache is take adequate sleep,
Hmm.
avoid acidity, then just massage the temples gently,
Right.
and use a local balm. Avoid bright lights. The
Hmm.
minute you feel the headache is building up, cover your eyes. Don't allow bright lights to fall on your eyes. Lie down in a dark, quiet room for 15 to 20 minutes, and you can the headache can be averted.
Okay. We're done with all the questions. It was a very informative session, Dr. Padma. And again, I'm repeating for all the users who want to have on this topic or any topic related to your pregnancy, your conceiving, you can consult Dr. Padma. There is a video consultation. The link is given below in the feed post. Kindly click on it and book a video consultation with her so that you do not have any more doubts in your mind. So thank you, Dr. Padma. Please follow what Dr. Padma has told. Maybe it will benefit you in getting better sleep and solve all your doubts that you had. Thank you so much, Dr. Padma. It was
It
great
was a
having you.
pleasure. Yeah, it was a pleasure. Thank you so much. Thank
Thank
you.
you.